provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
All right, we are so glad to have everyone back on this Thursday. We're actually going to do something a little different today, and we're going to start with FAQs, or sorry, not FAQs, but we're going to start with our Q&A since we haven't been able to answer many questions for the last two webinars. So I have a few questions from last week, and then if anyone has any pressing questions, go ahead and send them now in the chat box, and we will try and answer as many as we can, and then we'll get to today's topic. So as of now, I'm going to welcome your FIRRIMup doctors, Dr. Anjali Mon-Aki and Dr. Kathleen O'Neill-Smith. There she is. There they are.
Hi, everybody. Hi, Dr. Kathleen.
Hi, everyone. How are you? Everybody okay in the storm?
Yeah, everything's great. I'm actually in Oregon this week visiting our younger son, Derek. Dr. Kathleen.
Oh, no, so you're missing all of the fun in the Gulf.
Yeah.
Hmm.
Yeah, there's a lot. You know, it's hurricane season still in Florida.
Yeah, we're feeling the rain up here, but it'll get worse over the weekend, I'm sure. But I hope everyone's safe.
Yeah, well, thank you, everybody, for joining us. FIRRIMup Doctors webinar. We're in our 24th week already. Hard to imagine.
Oh, gosh, that is amazing. 6 months.
Yeah. Next slide. So last week we ran out of time talking to you all about the fascia. So we thought we'd try to get to the Q&A first to catch up from last week. The first question was about flu shots. Dr. Kathleen, at what point do you recommend that we get flu shots?
Right. I mean, I think hopefully for now, I know that they're aggressively being pushed right now, and I think it's a little early. I mean, I'm hoping that this flu season is not as bad as last year was because we're distanced. And I think for those of us who are staying physically distant, socially distanced, hopefully it's not going to be as much of a problem because, you know, it's a respiratory illness as well that gets transmitted through coughing, etc., and hands, you know, the same thing with the fomites and the droplets on the hands. But I think at this point, if we're distanced, it will be less. And I do think that for those people who are immunocompromised, they will want to get a flu shot. But I'm thinking later in the, you know, more like October. And I know you have thoughts on that too.
Yes. So for my population in Florida, I'm recommending they wait until mid-September, October, because a flu shot's good for about 6 months. And if you get it too early, the protection will wear off before the end of the flu season, number one. And number two is if you looked retrospectively about what happened in the first quarter of 2020 this year, normally after Christmas, there's a spike in flu, but the studies are showing that because of social or physical distancing, the spike was blunted. So we should have less flu if you're following physical or social distancing.
I think with all vaccines, for me, I have two principles. One is that try not to get 2 vaccines at the same time. So if your doc is offering you a Pneumovax at the same time, I would get 1 vaccine at a time. And then second thing is I also think that try to get a flu shot if you know you've been sleeping well. If you show up at the doctor's office and you're unwell with some other problem and your sugars, let's say you have type 2 diabetes and your sugars have not been good, that's not the day to get a flu shot. You know, going in and getting a flu shot in a setting of, you know, being at your best is always anything that you do in medicine, whether it's getting a surgery or anything. Ideally, you're at the top of your game when you have that intervention, including vaccines. I feel very strongly about that.
I agree as well. Separating out your vaccinations is really, really important. You don't want to overwhelm your immune system, especially with the threat of getting the virus SARS-CoV-2 right now.
Correct.
The second question was about testing. The question was, is there a difference between the technique if you just go in the anterior nasal versus the deep nasopharyngeal versus saliva testing in terms of sensitivity, specificity?
I think all of the testing is different. I think all of the testing is definitely operator dependent, meaning whoever's doing the test has to know how to do the test. Otherwise, it's not as valuable. And I think that, they all have their own sensitivity and specificity in a perfect world. I've done a lot of testing, and I'm just finding that because everything's been hurried in terms of getting, EUA status and being expressly trying to be utilized and helpful, it's really a mind-boggling, confusing mess. And so I think that what is really important is you can ask the person doing your test if they know how to do the test. Have they done the test before? And I think it's really important. If you're on this webinar and you're a patient of Dr. Akey's, I would certainly go to her office. They've done lots of tests, but everyone should be trained. It doesn't mean that they do it right. So I think the results are the results. And so you'll see what your results are when you come back. Likely if it was intended to be a deep posterior nasal test and they did it anteriorly, they'll be negative. And it means that you just have to wait and consider doing other testing and have a conversation with Dr. Akey, if she's your doctor, and I'm assuming she is based on this group, about which test to get, because you really have to get the test that's most valuable for you. Our book, I think, identifies the different types of testing, certainly the ones that are done to detect if you have recently been exposed and to detect if you have had exposure in the past and the infection is gone. So you really have to know what you're testing and what the pretest probability is of the results of that test. So I don't think there's a standard answer that I can give you because it is complicated.
Yes, but in general, the deep RT-PCR, deep nasopharyngeal swabs are better than just the antral or the front of the nose ones.
Sure.
But even those still have a 30% false negative rate for acute COVID. So if you have the symptoms and signs, we're going to stick by what we wrote in the guidebook. You can't smell, you can't taste, you've got that weird chest pain, you feel terrible, you probably have COVID. And
It's always COVID until proven otherwise, if those are your symptoms, for sure.
Yes, within our practice, we call you a PUI, person under investigation, meaning you're acting like COVID, you got exposed, you had a negative test, we're going to treat you like you have COVID and potentially retest. So our population is getting tired. The high risk and the moderate to high risk people have questions about sheltering in place still in Florida. I don't know how you're doing in Boston, but there's a 40% rate now of anxiety or depression, 6 times higher than this time last year, according to the MMWR published by the Centers for Disease Control. There's mood disorders. And then a sad study said that 1 in 10 people surveyed in the month of June actually seriously contemplated suicide. And I think that a lot of this not only has to do with the stress of potentially losing your job or different workplace or different home life, but really the socially distancing. And so this
loneliness.
Yeah. So the question was about sheltering in place.
Mm-hmm. Loneliness and uncertainty are 2 things that don't really like to be, experienced at the same time. At least with uncertainty, if you've got other people in your bubble, in your community, I think it's really much more kind of, at least you have someone to talk to, at least you have the presence of another living person. And so even sometimes if it's negative, unfortunately, but I think that loneliness is really difficult to experience day in and day out. And I am one here. I mean, most of my population have bubbles and they have people that they know are safe, they know that they can be with, they know that they can spend time with physically, and that they can have dinners with and walks with and conversations with, regardless of the rate of COVID spread. So if you really can have a conversation candidly with a friend or a family member and say, hey, can we agree to let each other know if we're going to go out and be social or be in a risky situation, which would be a lot of people, no protection, etc. I don't think, I think that it's pretty easy to know who those people are that would do that in your small little circle. I know who they are in mine, and we're not seeing each other physically. So I think, but I also know the people that are staying home, the people that are very cautious, and I'm seeing those people regularly. They're part of my inner circle. They're part of my bubble. And it certainly has helped me to not feel alone. And I recommend everybody find a bubble.
And preferably meet outside in fresh air. If possible.
Outside is always relatively safe with masks. But if it's people that you know very, very well and they're not going anywhere and you're not going anywhere, you can be together. I mean, I really don't think that's an issue. Let's say that there are people there are two people in a household in one place and two in another, and neither people are working from home or they're not going out or they're having groceries delivered. Those two couples can come together. So I think you really just have to know the people that you would be with. But bubbles are really important. And look at the NBA. They have a bubble. They don't have any cases. The NBA is in a bubble in Florida, right? In Orlando. And the number of cases is really small. So I think that's pretty phenomenal. Whereas the teams that are traveling are having much more of an issue.
Good point.
Mm-hmm.
All right, let's move on. Those were last week's questions we didn't get to. And we'll just go ahead and move on with our webinar. Next slide. So there was a question that about fascia, since we brought it up, and the question was, is fascia like Gossamer fabric? And so Dr. Kathleen had to tell me about Gossamer fabric.
Gossamer.
Gossamer.
Mm-hmm.
But anyway, it's when I looked it up, it's like a spider web type of lacy fabric, and so the answer is yes. That was a good observation, whoever submitted that question. But this is a picture of fascia, and basically it's like a spider web, and it has tensile strength in multiple directions. And this is a fantastic video on YouTube. The source is at the bottom, called "Strolling Under the Skin," by an orthopedic surgeon in France named Claude Jean-Berthaud, who actually has an atlas, who for the first time we were able to visualize fascia. And it's really, this is free on YouTube for you to take a look at. So that we wanted to follow up on that question for you as well. Strolling Under the Skin on YouTube. All right, so this is now to our statistics. This was us at the beginning of March. Next slide. And here is the United States now. All right, North Florida. Yeah, well, the United States, 5.8 million, 180,000 deaths. Wow. Florida, about 4.5 million tested, 612,000 confirmed, about 11,000 deaths. In my county, Alachua County, about 5,082 confirmed, 31 deaths, and we've had over 30 patients with COVID. Our stats are good within our practice. A lot of people are doing the immune fortification that we outlined in our guidebook, Dr. Kathleen, as well as soon as you get exposed, or if you have COVID positivity, or if you're a PUI person under investigation, we actually offer to see you every single day to get you through it. And at this point, only 3 have been hospitalized. 2 ended up in intensive care, but nobody has been intubated. And the 2 who were intensive care, 1 has recovered and back at work already. And the other one, it has a little bit residual lung inflammation a month later, but she's doing well as well.
That's fantastic. I mean, one of the things I want to say about these numbers in terms of the test results, total test results, those numbers are slightly skewed and slightly will be skewed if the new CDC guidelines are followed, meaning, the goal was to test people who had been exposed so that we could suggest quarantine. And by quarantining people who had been exposed, that would mean that they wouldn't be silent spreaders or super spreaders, as we call them sometimes. But the reality is that what we really want to understand, and the only number we can know for sure, is a number of deaths. But even with number of deaths, having been a pathologist and knowing and actually writing the cause of death on death certificates previously as a doctor, when the pathologist or the coroner writes the cause of death, it's actually a doctor, they basically, there are many, many issues that are going on in somebody around the time that they die. So I think there's some confusion around how many deaths are called COVID and what happens if you say that you had a COVID death. Maybe the hospital gets more money. But I think in general, it is believable that there have been at least 1,000 deaths in Suffolk County, and in Massachusetts, 9,000 deaths, and just possibly 30 deaths in Alachua. In terms of the US, it's a big number. It's hard to know, but it's definitely in the hundreds of thousands. So these numbers are a little bit confusing sometimes to me. So I want to just suggest that they take them with a grain of salt. But the bottom line is, in Alachua County, it's going really well, I would say, from the big picture, look at these numbers. In Massachusetts, it's going really well. In Florida, you've been, relatively on fire over the last couple of months. And I think you're probably holding your own. So let's hope it stays that way or goes in the downward spiral direction. That would be even better. But I think these numbers can be a little bit confusing.
Yeah. And, that kind of reminds me of how you in Boston, how you had talked about the Biogen conference back in February, March, or early. It was in February, where I read an article that said that there were about 300 attendees from all over the globe, and looking at the RNA virus, it looks like they spread it to 20,000 people.
Can you imagine? And not all 300 attendees were sick. I mean, my next door neighbor was at the conference. She works at Biogen. She never got sick. I did 5, 6, 7 tests on her. She insisted she had it. She said, you don't understand. I had to have had it. I've been with people that have it. I've been this close to them. She didn't have it. I mean, it's amazing how some people get it and other people don't. So it's pretty interesting that I believe that 20,000 people around the globe were infected from that small group, because it was a very global group. China, Europe, everywhere.
I'm staying in a hotel for this trip to Oregon, and I just remember a paper I read of a woman from China who actually knew she had COVID. So she self-quarantined in her apartment building, but unfortunately used the elevator. And so through using the elevator, she transmitted to 77 people.
It's amazing. Yeah. So that's why the numbers are a little bit confusing. And that's why I do think that we should do testing. I don't think testing should be complicated, but it's complicated because of everybody trying to get on the bandwagon in terms of getting their test out there. And, I think with a real goal to help, but everything hadn't been vetted appropriately.
Good point. Next slide. So Alachua County, this past week, it hasn't been too bad. It's 51 hospitalized, but again, looking at the case fatality rate, it's 6 out of 1,000. Whereas in Wuhan at the beginning, it was 6 out of 100 people who got COVID died. In Alachua County, it's 6 out of 1,000. Now, 1 is too much, but it's a lot better than it was when we initially were encountering the COVID-19 infection. Next slide. All right, today's topic is on glutathione, the grandmother antioxidant. The FAQ is, how does baseline glutathione levels affect the course of COVID-19? Next slide. So many of you all know that next slide, that I use, this was from last week's. This is just to remind you, go back to that slide. This is to remind you of what we were talking about with fascia. Dr. Kathleen did a great job explaining injury, be it to a sprained ankle or my broken finger, or thyroid, acute, subacute, and chronic phase. So do you want to just recap that briefly and say how glutathione plays into this?
Sure, of course. So remember the web that we showed earlier in this slide deck, one of the first slides that we showed that looked like the web that's a little bit gooey looking. When we think of muscle, we think of muscle not as an organ often, but muscle is an organ. And we'll come back to that fatty liver question that somebody had last week. But muscle is an organ, just like the heart is an organ, just like the brain is an organ, just like the pancreas, and all all of our organs are the same as muscle. So muscle is just a way that we can study other organ systems. The skin is an organ, right? So when we think of organs, we don't want organs to get fatty infiltration. With an injury, organs will get fatty infiltration. That's what happens. And not only will they get fatty infiltration, that goo, that fascia, will build up with things like lactic acid. Lactic acid is an oxidant. It creates something that we call free radicals or oxidative stress. So lactic acid is what we call it in the muscle. In other organs, it can be other kinds of acid. I won't get into the names because it could be very confusing, but just imagine that all organs have their own type of lactic acid. That lactic acid is, again, oxidative stress. The way glutathione plays into this is when you think of that fascia, that web, there's also fluid. There's a lot of fluid that's on either side of that goo. And within that fluid, you've got the lactic acid like chemical. And you need to counter that. And the master counter to oxidative stress are master antioxidants. Glutathione is the master antioxidant. It's like we think of growth hormone, and Dr. Akey and I teach on growth hormone to doctors. It's a master. It just does so many things. It works in every organ system. Glutathione works throughout the fascia around that surrounds each cell, each organ, and helps to clean up that fascia and to eliminate and to move along and get rid of the that waste, that acid that's bathing the tissue. When you get rid of the acid bathing the tissue using antioxidants like glutathione and vitamin C, which recycle each other, then you basically change the tissue and it doesn't bathe in acid anymore. When tissue isn't bathed in acid, then it heals. You know, as the lactic acid is moved out of your muscles, then your muscles feel better and then that they'll be stronger. It's the same with all tissue. As we move any acid substance out of that tissue will begin to heal and we won't get fatty infiltration. We won't get fat going into that tissue. We'll get a stronger organ. We'll get a stronger tissue, a stronger muscle, a better functioning liver if we have adequate glutathione stores. We'll get a clearer brain. A foggy brain, it can often be due to oxidative stress. If we do, even for Parkinson's disease, we can have somebody who may not be able to walk because they can't get going with Parkinson's disease. If we give them an IV of glutathione or just a push of glutathione, so it definitely gets to their brain, they stand up and walk. So we clean out that acidity that their brain is bathing in, and then their motor neurons can work and they can walk. So glutathione is amazing. It's necessary. It's generally natural to the body, and it's really important in all illness, including COVID-19.
The main morbidity and mortality with the COVID-19 infection has to do with cytokine storm, where there's an overexuberant immune response of our own bodies. And the body's releasing too many cytokines or chemical messengers in the blood. And it includes increased oxidative stress, and it makes it difficult for the body to detoxify and repair the cells. So it's really important that we have enough glutathione. So there's this doctor, Alexei Polonakov from Russia, who published this viewpoint saying that in his opinion, based on the prevailing data on glutathione, that glutathione deficiency is a major contributor to worsening of the cytokine storm. So you want to go into the COVID-19 infection with appropriate levels of glutathione. Next slide. Next slide, please. Okay, so basically, how do we get glutathione deficiency? Going back to that picture, if you're over 65, you're going to have glutathione deficiency. If you have low glutathione intake, i.e. you don't eat a lot of cruciferous vegetables, which actually have a lot of glutathione, avocado has a lot of glutathione, green beans, asparagus has a lot of glutathione. Chronic diseases such as obesity, type 2 diabetes, cardiovascular disease, respiratory disease, and liver disease. So that's what he was saying in his paper, was that the same people that are at risk for cytokine storm or COVID-related lung disease are the same people that have glutathione deficiency down here in the bottom box. If you smoke, you're using up your glutathione pools, so you don't want to be smoking. And then male sex, actually, in general, males have lower glutathione than females. And so it's interesting that the same population that is at risk for cytokine storm are the same population that have low glutathione levels. So up there on the bar, the top of the bar where it goes, there's a virus, it gets infected, then you get viral replication. Remember from our teaching before, stage 3 is oxidative lung damage, hyperinflation, acute respiratory distress syndrome, and death. So stage 3 and 4 are in the orange and red over there. And so you don't want to go into this having low glutathione levels.
One of the big things about glutathione is that there are many genes. So when we talk about epigenetics and food and other things affecting our genes, I don't think that you need to measure your gene. You can just measure your glutathione level. And once you measure your glutathione level, I know that there's a little controversy over that, but no matter what, you get your level, you compare it to you. And you can see relatively that if you have a low glutathione level, it's likely that you have a genomic that impairs your glutathione production. So I think that having crucifer vegetables can improve it. But if you know that you're more prone to having it, that would be very helpful. So I think it, for at 2 or 3 points in time, you should have your glutathione level measured.
Yes, and we can order that in regular labs like Quest, LabCorp. Next slide. Next slide, Emily. So the bottom line is you want to make sure that you're eating enough glutathione in your diet and that you're not using it up through excessive oxidative stress, either smoking or doing things that would be using up your glutathione. You want to be eating a rainbow of colors. Especially the greens.
Oh, well, for glutathione, especially the crucifers and the greens, but you also need other antioxidants, and they all work together. So vitamin C and alpha lipoic acid will work with your glutathione as antioxidants and recycle each other. So the reds, the yellows, the oranges, the greens, the purples, the blues, all of those are antioxidants and are really beneficial for reducing oxidative stress. And we all have oxidative stress every day. Every single day we all have it. We have to keep cycling it and moving those acid-like chemicals out of our system.
That, and also making sure you're eating enough protein, because glutathione is a tripeptide of cysteine, glycine, and glutamate, which is why you can get some glutathione from N-acetylcysteine as well. My favorite is what I call the ageless triad. Those of you who are in the practice in Gainesville, I like liposomal glutathione, which is on the bottom there. 1,000 milligrams a day is my normal dose. But I actually couch it with another antioxidant, vitamin C, which is in the upper right, and liposomal curcumin, which is anti-inflammatory. So you have 2 antioxidants and 1 anti-inflammatory. That's why I call this my ageless triad. And for me, I do 1 teaspoon of each twice a day. It's better than a coffee break. So the dosing is best done about 10 o'clock and a 2 to 3 o'clock, exactly when you'd want that espresso if you were in Italy. When the cortisol levels are low, this is much healthier than an espresso. So this is our recommendation to you all, to get those levels up, in addition to eating the rainbow of colors and decreasing your oxidative stress. Try not to inhale pollutants, don't smoke, exercise.
Processed foods, yeah.
Bad food.
Processed foods, yeah.
Okay, next slide.
That was actually it for you guys. The
Okay.
next slide.
Well, thank you all for coming. I was happy to be with you all from Oregon. I'll be back in Gainesville next week. And Dr. Kathleen, it's always a pleasure to teach with you. Thank you, Emily and Nicole, for working this. Thanks, everyone, for coming.
You're a rock star, joining us on your vacation. Thank you, Dr. Akey. Thank you all.
Thank you both. All right, so if you would like any of these that Dr. Akey just talked about, we're going to offer a 10% off code, again, valid from the 27th till September 20th. And if you use the code FIRRIMup ageless, that's FIRR. Jakey is now available. You can find it on our website, FIRRIMupDoctors.com. And the 20% discount code is good and good through December 31st. So if you use the code SCI20, you can take 20% off either the hardback copy or I believe it's the ebook copy. But either way, this code will take 20% off for you. And as always, our Kick COVID-19 to the Curb is still on sale, $29.99 for a paperback version and $9.99 for the ebook, which is available on Google Play, Barnes & Noble, and Amazon. And with our August special, if you purchase the book in either format, you can get 20% off of vitamin C and zinc. Again, this is all good while supplies last, and as long as you can show proof of a receipt, we will go ahead and honor that 20% off for you guys. And that is it for today. So I hope everyone has a great weekend, and we will see you back next week.
We're so glad you joined us today.
We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMupDoctors.com. That's FIRRIM updoctors.com.
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out. The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience